my pleasure to interview Dr. Howard Hunt. As a part of the University of Nebraska College of Medicine Centennial History, Dr. Hunt and I have been sitting here, and he commented to me that he came on campus in 1930. I also commented to him that when I was here as a student and also at Methodist, we used to call you Horrible Howard Hunt, and you made some comment about you've been called worse. So since you were here in 30, beginning 57 to now, how have things gone as you look back at this long period of time? How were things here on campus when you came in 1930?
Well, my experience in Nebraska has been most rewarding, much more than I expected it to be. There have been tremendous changes, as you're well aware, Frank. When I came, the hospital units 1 and 2 were open. We had originally 250 beds. They'd already converted one ward at that time to a nurse intern's quarters. So that cut it to 230. And I think the last I knew, what's the capacity now? 285?
That's almost 300, yeah.
About 300. Mm-hmm. So it hasn't changed too much since way back in 27 when it was 250 beds. There was quite a difference in that at that time we had only open wards with 20 patients to a ward. Nurse's station was in one corner of the ward, and she could see every patient in the ward, of course. And we had 2 or 3 side rooms where the people were placed who were critically ill or should be in a recovery room these days, but it was more the expiration room than a recovery room. Mm-hmm. But however, there was this special consideration made for the very sick patients. Now, this wasn't true only at Nebraska. The same situation existed at the University Hospital at Ann Arbor, where I was mm-hmm. before coming here. So there's been a great change in nursing care and also a great change in the cost, of course. At that time, the Methodist Hospital had rooms available at $4 a day in these wards. I mean, a bed was $4 mm-hmm. a day. This is the amount that counties paid the university for taking care of their county patients when they were sent in, was $4 a day. And now, I think the last time I was in the hospital, my basic charge was $120 a day. Of course, I had a private room. I wasn't in a ward. Mm-hmm. Mm-hmm. But this is quite a great change. In addition to that, of course, you're charged for all sorts of extra things now that sort of went along with the room charge many years ago. That's just one aspect of this whole thing.
When you came on campus in 1930, who were some of your clinical colleagues here at the College of Medicine?
Well,
teaching in radiology, who were your colleagues in the other specialties?
Well, first let me tell you who was here in radiology. I came as assistant professor and chairman of the department. On campus at that time there was Dr. J.S. McEvan, and he had a Ph.D. graduate pharmacist from Creighton and an M.D. He was part-time in radiology. He came here originally as hospital pharmacist. He was also chief of anesthesiology. So we wore these 3 different caps. He was my right-hand assistant. I brought with me a resident from Detroit. Who was just finished an internship at Detroit Receiving, came on here as a resident, and I had to train him as a supervisor in the department. Underneath him, he always had a rotating intern, because every intern spent a month in the department out of a 12 months internship. There were no x-ray technicians. Films were all taken by the intern and the resident under my supervision. I was also in charge of physical medicine. And in physical medicine, the only help I had were student nurses who rotated through the department. We got a new one every 2 weeks. One of them a senior, one a junior. And the senior taught the junior physical medicine under my supervision, supposedly. Mm-hmm. Also, medical illustration was under my chairmanship at that time. We had nothing like this. I had one photographer by the name of Shoemaker, who was primarily a portrait photographer. And in the shuffle of our budget dropped about 20% the year after I came because we were going from 30 into 32 when we hit the bottom. So he couldn't afford to work for $200 a month anymore, 150, whatever he got. So I brought in a young nurse who served as photographer. But I found that I needed her also in radiology, so we taught her X-ray technique, and she spent the mornings in X-ray and the afternoon doing the clinical photography. Later, we brought in George Fow, and George was a master at making lantern slides and doing that sort of thing. The other full-time person I had was one secretary in the Department of X-ray.
Who were your colleagues outside of Department of Radiology?
Chief of surgery was B.B. Davis, whose primary bailiwick was the Emmanuel Hospital. Head of medicine was E.L. Bridges, and he worked chiefly at the Methodist. Head of pediatrics was Howard Hamilton, and he was a nephew of Dr. McClanahan, who was the previous chief of pediatrics here. And Pollard was head of OB. Obstetrics, curiously enough, was part of surgery. It wasn't done under the Department of Obstetrics. Obstetrics was limited entirely to obstetrics at that time. But it's gave me a great advantage, too, in the management of carcinoma of the cervix.
Right.
Because it was either surgery or nothing. And, of course, the Department of Radiology at that time could offer radium therapy as an alternate in the treatment of carcinoma of the cervix. The surgeons were not interested. The gynecologists didn't exist here as such. Palmer Finley had been on the staff at one time, a man of gynecologist of international reputation, but he had a falling out with Cutter, and they just parted ways. So they
Whatever happened with that? I've heard about that falling out historically. Do you know of anything else that occurred?
Well, only that Finley told Cutter, you either do it my way or I'm resigning. So Cutter merely said, we accept your resignation, Palmer. And that's all there was to that.
That's not an involved story. That's pretty straightforward. Okay.
He was a good scholar, though, Palmer Finley was.
Okay.
Let me see. Now,
You mentioned surgery, chairperson,
surgery,
medicine.
those are the four departments at that time. Well, I was under Gifford, and nose and throat was under Wherry. And that was it. None of these people were paid any salary, you know. I think I was the highest paid clinician in the whole program. I got $300 a month.
$300 a month?
Yes, when I came as chairman. And of course, I wasn't full-time, you see. I was part-time at the Methodist. At the Methodist, the second month I got up to $73.98 the second month because I worked on the net, 50% of the net income. That was the way in which I was paid there at that time.
Okay.
So this was what the finances were.
So
of course, corn was 10 cents a bushel about that.
Corn was 10 cents a bushel.
Instead of $3 a bushel, like it is.
Some of the people I've interviewed, as you know, have commented they were unable to get married because their parents wanted them to have earned $200 a month before they got married. So you're talking about that kind of a time, aren't you?
Yes. And of course, sometimes we had to take produce in place of coins, you know. I remember one chap whom I treated for carcinoma of the skin of the face. He'd caught a beaver on his farm, and he skinned the beaver and sold the hide and gave me the carcass as a meat delicacy. And it was quite different and unusual. But I mean, this shows to what extent things went. You could even taste the poplar bark in the beaver meat. So I mean, actually, we were getting paid in kind, in goods instead of money.
Right.
In some of those accounts.
Did you have much contact with the basic science?
Oh, very close contact.
I thought you did.
My primary training was in basic science. I taught comparative anatomy at California. I taught as a teaching fellow at physiology at Harvard for 2 years. And I was very close to all the basic science people, always have been.
You mentioned also you took your radiology residency. Then you came here, and the chairman from here went to Michigan?
He went to Michigan, yes.
Okay.
And he went there supposedly to become chairman, but although he made professor,
That was Pierce?
Dr. Pierce. He was an outstanding radiologist.
He had been here for quite a while?
3 years.
3 years.
He came in 27 when Unit 2 was open.
All right.
Before that, Dr. McEwan actually was the only person who was around full time. There was Dr. Ballard who officiated as the professor of radiology, but I think all he did is come and give some lectures.
Is that the same McEwan who was also chief of radiology at Lutheran Hospital?
That's right.
I knew him.
He died just about 2 years ago.
I knew him.
Yes, sure.
Yes. But you knew the basic science people. Who were there in the basic science when you came in 1930?
Well, in 1930, of course, Margulies was here, and Latta and Pointer were here. Ed Holyoke was a student at that time. In physiology, I knew, in pharmacology, I knew McIntyre very well. McIntyre also came here from the University of Michigan, you know.
Mm-hmm.
And McEwan also started in engineering, the same as I did, which is interesting.
Was Bennett here on campus?
Yes, he was here
All
then.
right.
They were a great pair, I think.
Mm-hmm.
Had a fabulous department.
Mm-hmm.
Of course, we were very close to the Tolmans.
Now, he was dean then?
No, he wasn't dean.
No, but I mean, later on.
Later on, dean,
Yes.
yeah.
Yes.
No, Perry, of course, took his medical training here. He went to Peter Van Brigham Hospital. I don't know, have you interviewed Perry Tolman?
Yes. Yes.
But it's very interesting, I think, that he came from, his background is in the Brigham Hospital. I spent 4 months at the Brigham myself, and but on Harvey Cushing's service for 2 months, same as Keegan took his training with Harvey Cushing, only mine was pretty superficial. And Cushing was a very severe disciplinarian, and I think maybe that's the reason that the neurosurgeon here was such a disciplinarian.
Keegan,
yeah.
Yes.
Because he was a very strict disciplinarian. He expected the ultimate from himself and everybody who worked with him.
It's kind of changed a bit in medical education, hasn't it?
What's more permissive?
Yes.
Yes.
What do you think of that particular change, if I may ask?
Oh, it's all right.
Okay.
Bother me. I was never a very strict disciplinarian anyway.
Yeah.
Even though I had this, I never knew I was called Horrible Hard. That's
Well, I opened the program by commenting on that because I meant that in an affectionate term because you were so enthused in your work. And I think you also were demanding as far as technique and
I
getting
still
it
am.
done right.
I'm still sort of
You're
an
still that
SOB,
way.
yeah.
And for the student who was trying to figure out where the uterus was, you know what I mean?
Yeah.
You could be very demanding of the students, so we would call you Horrible Howard.
Another
But you
one of
were
my-
younger and your hair was longer and you were...
Yeah, I had more of it too. One of my favorites here in the early days was Charlie Baker, though.
Okay.
It was Charlie Baker, and was my first intern when I came here. And I so well remember on the 4th of July, which was just 2 days ago, you know, we x-rayed this patient who had a gastric ulcer about 3 cm in diameter, 4 cm. I'd never seen a bigger one. We had no air conditioning. We put on these lead rubber aprons, closed all the doors and windows, and sweat in there, along with our patients. Temperature, for a month, it went above 100 every month, you know.
Wow.
Air conditioning has been a tremendous boon to the comfort in hospitals and for patients. I think it saves a lot of lives.
Came in 30. When did you leave the faculty here, as far as full-time position?
Well, I was never full-time.
Well, I
See,
mean-
I left in when did I?
You had the position here and at Methodist.
Yeah. Well, I left here in about 1960 because at that time the AMA, Council on Medical Education, was demanding that there be full-time faculty here in radiology and pathology and all clinical services.
Mhm.
And I was part-time, so they gave me the choice of becoming full-time here or leaving, so I left and became full-time at the Methodist.
Mhm.
And we brought in Dr. Paul St. Aubin from MGH and Harvard to become the chairman here. And he was chairman for 2 years. And the situation so far as approval was no better even after the 2 years than it was before. So he left because he felt he couldn't run right sort of a department on the budget which was available. Dr. Whitson brought me back in as chairman under the understanding that I'd be full-time, which I was very glad to accept as full-time here. So I only became full-time actually in 1965.
Right.
Yeah, I think I left here in 63. That was it. Came back in 65.
What's this rumor I hear that you've retired?
Well, I'll retire someday, but last Saturday I worked at the VA, and I still go to Blair Monday, Wednesday, and Friday, half days or whatever it takes.
I smile when I say that because I was asking Dr. Sievers that he said he was retiring slowly.
Yeah, well, I am retiring slowly, too.
Yeah,
I'm
it seems that
retiring.
many of the doctors that get up in years, they retire slowly. They stay very much involved in their profession. It's been a major part of your life, hasn't it?
Oh, yes. Yes, I sort of feel lost in the days when I don't have to go to Blair or don't have to go to the VA. So I still go to the medical conferences every morning at the Methodist at 7 o'clock, at 8 o'clock every Saturday. Pardon me, every Saturday at 8 o'clock. They put on an excellent program for the GPs, and that's what I do at Blair, of course. That's a general type of practice. As I was saying, the work which I do at Blair right now is the same as I was doing at the University of Nebraska Hospital in 1930.
That's interesting, isn't it?
Yeah. Except we don't do any pneumoencephalograms up there, which we were doing here in 1930. But everything else is about the same.
Well, thank you very much for coming.
Well, thank you for asking
Sharing
me.
the events of the major part of your life and also your contacts here at the College of Medicine. Thank you.
It's been very rewarding.